Hello and welcome. My name is Alana Gordon. I'm a reporter at The World covering global health. This is a live Q&A about Omicron, vaccines, and holiday travel, the latest updates. Joining me is Stephen Kistler. Stephen is a research fellow in the Department of Immunology and Infectious Diseases at Harvard's T.H. Chan School of Public Health. Stephen, thank you for joining this conversation. Hopefully we'll get some questions. I'm not sure there's much to talk about right now.
Thanks so much for having me.
And for everyone tuning in, you can email your questions to the forum at hsph.harvard.edu. This Q&A is jointly presented by the forum at Harvard's T.H. Chan School of Public Health and the World from PRX and GBH. So, Stephen, the world has been thrown a curveball in this pandemic, a new variant called Omicron. It has a large number of mutations, and some of this suggests the variant may have an edge at infecting or reinfecting people, and it's raising questions about vaccines. Around the world, nearly 1,000 cases of Omicron have now been detected across nearly 60 countries, which is quite a big swath of the world. And researchers have been racing to answer key questions. Again, how quickly does it spread? How dangerous is it? Whether vaccines and previous infections provide protection against it. So we're in this kind of tricky space of uncertainty, and at the same time, scientists like yourself are finding more clues each and every day about what's going on. So to begin, what are your big takeaways so far? Where are we at right now with what we really know or don't know yet about this variant?
So we are still in the early days of learning about Omicron. We know enough about it to know that it is concerning and is something that we're going to want to watch very closely. But there are a lot of different pieces of data that are going to continue to come in over time. So one of the first things that we realized about this variant, and this is really completely due to the rapid response of the places that first detected this. So we got our first samples, the genetic samples of this virus from South Africa, from Botswana, from Hong Kong. They sequenced the virus, and we were very quickly able to see that it carried a number of critical mutations in its genome that we already knew could be linked with both increased transmissibility and the ability to get around part of our immune response. So that's a big reason why the scientific community very immediately got concerned about this, even though we hadn't really seen what it would do in a real population. Now, a couple of weeks into having detected this variant, we've been able to see a very sharp rise in cases driven by the Omicron variant, especially in South Africa. We're beginning to see that in the UK as well, and in some of these other countries that you've just mentioned where we've detected the variant. So we know that it can spread. We know that it can spread in places that have seen substantial amounts of previous immunity. And really, one of the big questions right now is just how severe is it going to turn out to be? It's going to be a little bit of time before we understand the answers to all these questions, and maybe we can dig into some of that further. But for now, that's my high-level overview of what we know about Omicron so far.
So basically, it has potential, and there are signs in labs and in cases as it's spreading that it's something to keep an eye on that's concerning. And at the same time, what are the biggest uncertainties that you have right now?
Yeah, so in my mind, there are two major uncertainties right now. One of them is what's deriving its increased transmissibility. So there are two different ways that a virus can become more contagious, like this one has. And one of them is to just be more intrinsically transmissible. Basically, it can infect people more easily on a virus by virus basis per viral particle. Another way is that now that we're basically 2 years into this pandemic and a lot of people have been vaccinated, a second way where the virus can become more transmissible is by getting around our immune response. And when we look at it in the population, both of those things can look very similar. So there's this uncertainty as to which of these things is really driving these spikes in Omicron. Depending on what it is, that may well change the way that we need to control it. So if it's intrinsically a lot more transmissible, well, then that suggests that we're going to have to in some ways, the response internationally can be somewhat more similar from country to country, because that's that suggests that there's sort of a common factor leading to its increased transmissibility everywhere. But if it has to do with the immune escape, then there's a vast amount of variation in how much immunity there is between different parts of the world, which age groups have that immunity, how that immunity was acquired, whether it was through previous infection or vaccination, and even which variants it was acquired by, if it was by previous infections. There are going to be a lot more questions to answer there. So I think that's the first critical question, is sort of what is behind the enhanced contagiousness of the variant. And the second really has to do with its severity. And I think it's really worth sort of taking some time on this point, because there have been some early reports from some physicians in South Africa, I know for sure, that had suggested that some of the early clinical cases that they had seen were surprisingly not that severe. Which, I certainly hope that pans out. That's good news. It's definitely better than the alternative, where early cases would be extremely more severe. So that's a good thing. But I think it is also worth noting that we've, as the scientific community, we've really only been aware of this variant for a couple of weeks. And we know that it takes a while for a person to become severely ill from COVID-19. So there's really no way that we can have information about the real severity of this disease until it spreads into vulnerable populations, and until those populations have long enough to show up to the hospital. And then we can really start tracking just how severe this thing is. So unfortunately, that's one of the key pieces of information, is the severity. And it's going to be one of the longest waits before we have really clear information about what that severity is in different populations.
Is it possible, that a more transmissible variant may not actually become the dominant variant? Like, I just wonder if we've gotten some questions. Could this potentially in retrospect be overblown? Or are we seeing more clues, as you've said now, to imply that this will overtake Delta, for example?
Yeah. So I would say that, I'm always an advocate for concern over panic. So my hope is that none of us would reach the level of panic around this variant. And I think that there's not a need to, because we know for sure that, as concerning as this variant may be, we're not back to square one. We already know an awful lot about the virus itself. We know a lot of what we need to do to manage it. And I do think, and we'll get to this later, I'm sure, that certain elements of our immune response will still hold up against this virus. But that said, viruses evolve to become more transmissible. That's what they do. And so this virus in particular has really shown this incredible capacity to be able to cause a lot of infections in places that ought to have a lot of underlying immunity. So I think that we can expect to see major surges. I do expect that Omicron may well displace Delta in the coming weeks. And what I mean by that is that if you have two viruses spreading in the same population, and one is able to spread a little bit more quickly, or to infect a few more people on a per infection basis, it's just going to have an edge. So naturally, you can imagine that over time, just statistically speaking, more people are going to get infected with the one that is more infectious than the one that is less infectious. And so when you sort of add up all of those extra infections across an entire population, you end up with something that just causes more infections. I think one of the things that we're going to have to watch very closely is, will Omicron displace Delta? So will it completely replace Delta so that all of our infections are from Omicron? Another possibility is that we may even see sustained spread of both viruses. It's possible that, especially with Omicron's ability to evade the immune response, that even in the context of spreading Delta, that won't provide a lot of protection against Omicron. And so they won't necessarily be competing head to head. They might be co-circulating to some degree. I still expect Omicron to mostly take over, and within the next 2 months, probably to be most of our cases, much as we've seen in South Africa. But that's something that we're going to have to watch very closely.
Can you define evade immune response? And also, I wanted to lead that into a question about, then, what are some of the responses that globally make the most sense right now?
Right. So I'm glad you bring that up, because the word immune evasion, I think, is fraught. It carries a lot. There's been a movement to start talking more about immune erosion than immune evasion. And I kind of like that, because To me, evasion means this very binary on or off kind of thing, that you have either a variant that is susceptible to our immune system or that evades our immune system.
And it means that, just to clarify, that a person may be more likely to be infected even if they've built up an immunity from vaccination or from a previous infection.
Exactly. Right. And because part of the reason I like that term of erosion is because I think that it brings in exactly that nuance that you just mentioned, where there are so many different layers of our immune response. And so we can think about, the Omicron variant for sure is able to cause infections in people who have been vaccinated or previously infected to a greater degree than any of the previous variants that we've seen. But one of the key questions is, well, infection is just part of the story, right? We're interested in symptomatic illness. We're interested in hospitalizations. We're interested in critical care. We're interested in death. We're interested in long COVID as well. And those all have to do with different aspects of our immune system. So usually when a virus is immune eroding, let's use it in those terms, usually it gets around our immune system sort of in that order. So the Omicron variant, as I mentioned, is definitely able to cause breakthrough infections at a much higher rate. But we can expect that as we move up that ladder of severity, that our immune systems are going to perform better and better against this variant. And so I and many of my colleagues are hopeful that our immune responses that we already have through previous infections, through boosters, through vaccination, will actually be able to still provide us with a high degree of protection against hospitalization and death, against the worst outcomes from SARS-CoV-2 and from the Omicron variant, even if it causes major spikes in infections. Now, that said, we still don't want lots of infections, because the more infections there are, the higher the probability that you basically end up with more people in the population going to the hospital, even if the severity is totally equivalent. So I'd much rather not have a more contagious variant like we do. So that's part of the reason we're so concerned. Even if the clinical severity is not worse, the fact that it can spread more easily is very concerning. But all of that said, I do think that our immune response will provide us with some degree of protection against the most severe outcomes from Omicron.
That's super helpful. So what about the global response? What are the ways then in this moment of scientists like yourself have more information, have reason to be concerned, finding clues, and at the same time, is there any clarity on what are the best ways to address what's happening right now and address this threat?
Yeah. So first and foremost, global vaccine equity, and this is something that we've definitely been clamoring for quite some time. Really just in the past day or two, we've gotten a couple of really good studies that all suggest that that vaccination does provide some level of protection against the Omicron variant. And we can talk about some of those studies in particular and sort of what they can tell us. But the really critical thing is that if you've been repeatedly exposed to the spike protein, to the outside of the virus, either through natural infection or through vaccination, the more times that happens, the better you're likely to fare against Omicron. Now, the difficulty is that in many wealthier countries, we have had multiple doses of the vaccine. People have been boosted, whereas in many other parts of the world, they haven't even given as many primary doses as we've given boosters, for example. And I think that that's really a dangerous situation to be in, because we're going to be able to see major surges of severe disease from Omicron in places where vaccination rates are very low. And that's my greatest concern at the moment. So the best way to both prevent the spread of Omicron, but also in particular to prevent health systems from being overburdened, is through vaccine equity, through distributing vaccines as widely as possible, as quickly as possible, especially in places that currently have low levels of underlying vaccine-induced immunity.
I've heard scientists and some journalists liken Omicron and vaccinations, and I wonder if this analogy works for you. Like if you have like a person or a bird, like a pigeon, and what Omicron is like we recognize that pigeon, but maybe the pigeon now has like a mustache and then maybe later some glasses and a top hat, which makes it seem really kind of benign. But I wonder how that analogy works for you in understanding kind of the recognizing of something like a spike protein, or now with these mutations.
Yeah, that's exactly right. And we use metaphors like that all the time in the scientific community to get our own minds around these sorts of things. So I think it's a really useful way of putting it. And right, because what that expresses is that the essence of the thing that we're dealing with is still the same. Now at first that really was a question because the Omicron variant is so mutated relative to the previous variants that we've seen that there was some question as to whether it would behave in the body the same way that the previous variants have, whether it would use the same cells in our body to gain entry. Now we've shown pretty conclusively that it does. So it is in fact still that pigeon, but it's changed its clothes pretty substantially. And so our immune system, is it's not just looking for mustaches or the lack thereof. It's looking for all sorts of other pigeon-looking things with respect to this virus, right? And so I think that our natural immune system, through repeated exposures to the virus or through the vaccine, is able to sort of learn better and better what it is it's looking for. And so even as the virus begins to put on these different layers of disguise, we get better at recognizing it and better at healing from it if we do get infected.
As we were preparing for this panel, alert came up that the FDA's approved boosters for younger adults, I believe 16 and 17. How does that add, or does that miss the mark in terms of the focus of preventing the spread globally and in particular in places like the United States and for those individuals?
Yeah, so I'm encouraged by the fact that that boosters have been approved for these younger age groups. I tend to distinguish between the sorts of things that the FDA does and the sorts of things that the CDC does. So really what the FDA is involved in doing is determining whether there is a medical benefit for some sort of intervention. And the CDC is more responsible for making guidelines and saying, you should do this, or this is a good idea on a population level, on an individual level to do this. So sort of FDA gives the green light and then CDC gives the recommendations. Based off of all of the evidence I've seen, I think that it's absolutely a sound decision by the FDA to approve these boosters and to say that they are safe, effective, and valuable for people in these younger age groups. I do still think that, and I'm going to very closely watch the regulatory and recommendation process to see whether, on a population level, given vaccine supply, given demand, given the odds, the fact that younger people are less likely to end up with severe disease from COVID-19, whether it opens up as a recommendation or as an allowance. I think that there are, from my perspective, I'm an epidemiologist. I do mathematical modeling. I think that the vaccines are frankly one of our best tools against this pandemic. And so I would advocate for as many people to become vaccinated and boosted as possible, especially given some of the recent evidence about the value of a booster in the face of Omicron. But all of that said, there's so many different elements to weigh here, including this global vaccine equity, as I had mentioned, that are frankly well above my pay grade. So I'm encouraged by the response from the FDA, but I can't say that I necessarily want to come out and say that I have a recommendation for younger people to get the booster right now.
This week, the WHO had pointed out that more boosters have gone into people's arms since Omicron than shots into people who have not been vaccinated to begin with globally. This question's from Lee, just to follow up on this and clarify, because we've been jumping around a lot, and even in this conversation, just to kind of, for some grounding, what is the latest on how well boosters will actually work against Omicron? And we've gotten a lot of several related questions that I'll follow up on, but I'll leave that first because there is this big push in the United States.
Great. Yeah. So our understanding of this is rapidly evolving. The first evidence that I saw about the efficacy of boosters against Omicron came out yesterday. There were 3 of them. And so I'm still learning about this along with the rest of you. So I'm glad we get to have this conversation now because we have more information than we did 2 days ago for sure. It does seem like boosters provide a substantial improvement in a person's ability to neutralize the virus, the Omicron variant. relative to a person who has had 2 doses of the vaccine, or even a person who's had a dose of the vaccine and has been previously infected.
And you mean neutralize as in prevent infection, prevent disease?
Yeah, yeah, exactly. I wanted to get to that next. So,
Okay.
so one of the things that we do to measure the immune response to a virus is we basically take either the virus itself or a benign version of the virus that looks a lot like SARS-CoV-2, and we mix it up with serum, which is the part of the blood that carries the antibodies. And we see if that serum is able to prevent the virus or its analog from infecting cells. And that's what we mean by neutralization. So that is a part of the immune response, and is definitely one of the parts of the immune response that's I believe, is most responsible for preventing infections. So we really do care a lot about neutralizing antibodies, and they can be good as sort of a good proxy for how well our immune system might stand up. So these neutralization studies are some of our first lines of evidence, because they're some of the quickest to run, where we've been able to expose the blood of previously infected or vaccinated people against the Omicron variant. And we've seen that there definitely is a drop in this ability to neutralize the virus. But that boosting can increase your odds of neutralizing the virus quite a bit. So that's one of the reasons why I think that boosters make an awful lot of sense right now. But I really want to reiterate, as we mentioned before, that these neutralizing antibodies are just one specific part of our immune response. The other one that I want to bring up is the part of our immune response that we know is really heavily responsible for protecting us against SARS-CoV-2, and those are the T cells, the T cell response, which neutralizing antibodies are very specific. They will identify a mustache and a coat and the very specific elements of that disguise, but T cells are better at sort of like taking a step back and seeing the entire virus for what it is. They have a broader spectrum response, and so we expect those to probably stand up much better against the Omicron variant than these neutralizing antibodies. So the neutralizing antibodies, these measurements that say that they decrease with Omicron but increase with boosters, I think is very helpful. But also my hope is that the other parts of our immune response might actually fare even better than that. But all of them will be increased by getting a booster.
Do we know how long that protection would last?
Not yet. Unfortunately, that's one of those things where we just have to wait and see. There's not really anything we can do other than follow up people who have been vaccinated and see how long those responses last. Since booster vaccines in most places are a relatively recent phenomenon, we just don't have the data to really know how quickly those things might wane.
What about variation by age? That was another question that's been coming in terms of effectiveness or protection.
Yeah. So a couple things to say about that. First, I've actually been really impressed by how strong the immune response has been across age groups. There are a lot of vaccines that we have that aren't as effective in bringing about an immune response in older people. And that is true to some extent with the mRNA SARS-CoV-2 vaccines, which are the ones that I've certainly been following the most closely. But generally, older people do still get a very good response. There's actually, I think just today, even there was a study in the New England Journal of Medicine that was not looking at the Omicron variant, but was looking at the Delta variant, and showed that people over the age of 50 who have been boosted have much, much lower rates of disease from SARS-CoV-2 than people who have not been boosted. So even if the immune response may not always be as high in older people also have by far the most to gain, because SARS-CoV-2 is likely to be the most severe in those age groups. So actually, it's in those older age groups that my suggestion is by far the strongest to get a booster at this point.
We've gotten a lot of questions about travel. And I wanted to start first with kind of a big picture. If you're thinking about across modeling, across populations, preventing the spread of something like Omicron and infections, what's the best way to prevent that spread? It sounds like what you're saying is vaccinations, but I wonder if you can kind of elaborate on that, and maybe the goal is that the spread can't be prevented anymore. It's here, but what are the best ways to limit the spread? And then I want to use that as a way to transition into talking about travel, both internationally, domestically. We're entering the holidays. Lots of people have questions.
Yeah. So I think that travel restrictions, as we've seen at multiple stages in the pandemic, are kind of a blunt intervention, and they're pretty disruptive. They can even, they can even interrupt the progress of science. So they can delay our answers to some of these critical questions because it's harder to share reagents and it's harder to share information when travel is restricted. So I think that those kinds of restrictions have their place, but as you mentioned, now that we're beginning to see Omicron in nearly 60 different countries, it's clearly a very widespread phenomenon. And so I think that travel restrictions at this point are probably no longer going to be very effective. But there are ways to make travel safer for sure. And I, like many of my colleagues who I know you've spoken with on this segment before, I'm a strong advocate for both vaccination and for testing. I think that rapid tests provide some of the best protection we have against the spread of disease, especially as we now have a variant on hand that's going to be able to cause an awful lot of breakthrough infections. So vaccination, I'm beginning to think more and more of as a preventive against disease and severe illness, and tests as a preventive against spread. So I think that the recent guidelines to have a negative test for SARS-CoV-2 within 24 hours of a flight, updated from within 3 days, is a very good move. The sooner you test prior to travel or prior to a gathering, the better it's going to be, the better you're going to be able to detect if you might actually be infectious.
So I'm sorry, I'm just transitioning and looking. I just want to clarify though, like we've also, globally and in places where there may not be as high vaccination rates, what about these other measures in light of Omicron, like masking or social distancing, avoiding big gatherings, or these things that we, took really seriously early on before there was widespread vaccinations? Where is the place for things like that right now?
I think they're still critically important, and especially masking. At this point, I've realized in many of my conversations I've stopped talking about masking as a measure simply because wearing a mask to me is almost the same as like putting on a shirt before I go out the door, where it's just a part of the current COVID world, if you will. And that doesn't mean that I necessarily think we'll be wearing these things forever, but certainly right now with the emergence of a new variant and as Delta has been spreading, which is, still by far making up the most number of cases here in the United States at the moment, masks are very helpful in preventing spread. So wearing masks in indoor spaces, absolutely. But I think especially as we start to look into a period of time when we have high levels of Delta and increasing levels of the Omicron variant, a couple of other things that we can do include limiting the sizes of gatherings. So if you have fewer people together at a given time, that puts a cap on the number of people who might become infected. We know that super spreading events are one of the real ways that the spread of SARS-CoV-2 can just explode. But if you're not in contact with large numbers of people, you can't have a super spreading event like that. So keeping groups of gatherings relatively small, testing before those gatherings, really critically important. Ventilation remains really important. So that's one thing that I think remains to be really overlooked and underappreciated. So with holiday gatherings coming up, I certainly plan to, no matter how cold it is outside, I'm going to have my windows cracked by 4 to 6 inches.
In the Boston area, you're going to have.
That's right. I know. So because I really do, from everything that I've seen, getting some airflow from the outside can immensely reduce the amount of virus that builds up indoors. So if I have to put on an extra sweater or two, for me, it's well worth it.
So here's a question that's come up. So for the holidays, many people may be in situations where there's unvaccinated people and vaccinated people, whether that's adults or children, for example, like young children. So how can you advise on gathering safely in these circumstances?
So really these same things we've been talking about hold. And I think it might be worth just sort of going through them in the order that I would recommend. So if you can get vaccinated and have not yet been, I would say do it now. This is the time, especially if you're planning to gather with people over the holidays, first line of defense. Second, ventilation, of course. So even if, for example, you have a kid who's unvaccinated, even if they do show up while infectious, keeping some airflow, getting some good outdoor air in, making sure that the virus doesn't build up inside will be very helpful. Rapid tests, so testing before a gathering, even young kids, I think can be hugely valuable, and especially for people who are unvaccinated. Definitely taking a test before you come really hugely reduces the odds that somebody will bring contagious virus to a gathering.
What's the window? How far before?
So I would say as close as possible. So morning of, ideally, or even sooner. So the value of these tests in telling you whether you're currently infectious really declines a lot by the amount of time that you spend between taking the test and getting your result back. And that's part of why I think that the rapid tests are so much more valuable in this case than PCR, because by the time you get your result back from a PCR test, especially with the increased demand that there is for those things over the holiday season, it doesn't actually tell you that much valuable information. So testing immediately before a gathering, ideally the hour or two before, but maybe the morning of, is what we ought to be doing.
If I took a rapid test yesterday, are you saying that that may be inaccurate by today? This has come up in questions, so yeah.
Yeah, possibly. So we've actually done some work around trying to quantify exactly that question of how much does, really the question is how much does the sensitivity of your test decline depending on how long before some gathering you've taken the test. And the better the test itself, the better the underlying sensitivity of the test, the longer it will sort of maintain its sensitivity over time. But one of the things that we showed was that a rapid test taken a day before a gathering is in most cases going to be better than a PCR test taken 3 days before a gathering. So according to your question, definitely, if you have a rapid test the day before, that's going to cut into its ability to detect you a little bit, but it's still going to be pretty high. I would say, ballpark probably on the order of like 80 to 90%. But by the time you get to 2 to 3 days before, it really starts to decline pretty quickly. So.
Thank you for that. Now that some questions have come in about travel in this era, what about traveling with unvaccinated kids? And a more general question, how do you safely travel during the holiday season? And of course, that will vary based on vaccination status or booster status.
Yeah, absolutely. So, the first thing that I think about when I'm traveling is to make sure that I have a high quality mask. And thankfully, at this point in the pandemic, they've become somewhat easier to find. But I'm thinking about, certainly something like a surgical mask, or ideally, if you can find something like a KN95, something that's really rated to protect against everything up to the smallest particles from going through the mask. I think that that's really valuable for travel. If traveling by air, which I know many of us will be, I think bearing in mind that you're most likely to get infected while standing in line at security at the airport or waiting for a rental car, that actually being on the airplane, again, with their good ventilation, good filtration, it's actually pretty unlikely for infection to spread widely. So keep your mask on the plane for sure, but recognize that it doesn't make a lot of sense to pull off your mask while you're walking around the airport and then to only put it on while you're on the plane. If you're going to do one of those things, it would actually be better to do the opposite. And so, but I would say, be sure to be very vigilant about masking throughout the entire process. And I think, the other thing that I try to do is to just pay attention to the amount of spread that there is in the place you're coming from and the place you're going to. And I think that just sort of helps be prepared for what sorts of things you'll need to do when you get to the other side. If you're coming from a place with a lot of spread, you'll want to be thinking a lot about, okay, I want to make sure that I'm not bringing infection to other people on the other side, because of how much spread there is in my community, I have a reasonable chance of being infected without knowing it. So you want to think about taking a rapid test really quickly before you see people. On the other hand, if you're going to a place with very high spread, you'll want to think about, okay, so what do I need to make sure that I can stay safe and uninfected ideally while I'm there? What sorts of activities do I want to engage in? What sorts of masks do I need to bring to be prepared for the entire trip, recognizing that there's a lot of COVID spread happening?
Thank you. Sorry, there's so many questions here. I hope it's okay to run over a little bit.
Sure.
I want to jump to something else that maybe could come as people are traveling or in the wake of, or gathering related to holidays, right? It's about quarantine and isolation. Right now, the CDC recommends that fully vaccinated people exposed to COVID-19 get tested, but it doesn't call for quarantine unless they actually feel sick or test positive. In light of Omicron, do you think this guidance should change or require quarantine for vaccinated people who are exposed to COVID?
Yeah, I expect that this guidance may well change as Omicron begins to take a hold. in the United States. I think all of the evidence that I've seen is that, especially with Omicron vaccinated people, are likely to be able to spread the virus quite well, unfortunately. And so I do think that recommending some period of isolation after exposure will make good sense. But what I also hope is that this will come hand in hand with additional guidance for how to use testing to get out of that isolation period. And that's, again, one of the ways that I see the real value of rapid tests, where if you have multiple negative tests a few days after an exposure, I think you can really cut that isolation period much shorter than it might be if you just have to wait for an entire 10 days, 14 days, for example, to elapse.
Okay. Wow, that's different. This question is about the degree of COVID becoming endemic and long COVID. Is COVID-19, is the coronavirus now endemic? And what does that tell us about what we know about long COVID? Which is actually two very different questions from Henry, but also
great
linked in some
yeah
ways too.
Yeah, I think I can take them both, and in some ways they do really tie together. So the distinction between pandemic, epidemic, endemic illness is a little bit fuzzy. There aren't really any clear-cut definitions for when something transitions from being epidemic to endemic. In some ways, it has more to do with our understanding and behavior towards the virus than something with the virus itself. In my mind, sort of when we transition into an endemic period, it's when we've sort of acknowledged that we're going to be living with this virus for a long time, and we feel like we've reached some sort of acceptable steady state for our ability to deal with and manage the virus. And in those terms, I don't think we're there yet. I think, especially with the emergence of Omicron, we see that we're still sort of in this reactive stance. We're still trying to, we have to have crisis measures to deal with surges in hospitals. And we're very much not at a state where I feel comfortable saying that, well, this is just going to be the way that COVID is going to be for the future. So I still very much see this as an epidemic, as the continuation of a pandemic. I do think that we will reach a point where SARS-CoV-2 is endemic, much like flu is endemic and many other viruses that we have, but I don't think we're quite there yet. And with respect to long COVID, there's still a lot that we're trying to learn from this as well. And I'm looking forward to learning a lot more. I think with the question about SARS-CoV-2 becoming endemic, I think that is a major concern, because you can imagine if the virus is continuing to circulate, that if it has some probability of inducing long COVID in people, then that just increases the odds that one of us, will develop long COVID at some point in our lives. And I just don't think we know enough about what causes long COVID, what causes a person to recover from long COVID, and how that relates to the amount of virus that's circulating, how that relates to a person's level of previous immune protection. There are really more questions than answers. So long COVID is for me really one of the very concerning elements of this pandemic, and unfortunately, I don't really have much sense of what that is going to look like as we go into the future.
I know that you've done research on breakthrough infections, like working with the NBA. It's fascinating. I had this question, and it came up from Mario too, just to clarify, what's the evidence? You were alluding to saying, you said there's a lot of uncertainty, and at the same time, we know that Omicron can reinfect people, or people who are, can spread this, who've had COVID, who've been vaccinated more so. And I just wanted to clarify or ask, what's the evidence the variant has a higher rate of breakthrough infections?
Yeah, so we're still gathering some of that evidence. And I don't know that we can quite perfectly compare head to head with Delta, for example, that it does absolutely cause more breakthrough infections. But again, some of the evidence comes from South Africa, where despite relatively lower vaccination rates than we have here in the US, they've just emerged from a major Delta surge. And so we expect that a lot of their population has some degree of underlying immunity. And so the fact that Omicron is able to cause such a surge during a time when we expect a lot of people have been freshly immunized to some degree against SARS-CoV-2 suggests that there are going to be a lot of breakthrough infections here. That contrasts with the spread of Delta, which happened somewhat earlier, and many of the populations that it initially spread through in really explosive ways, we think probably didn't have quite the same degree of underlying immunity that we're seeing in South Africa. Again, part of the hint comes from the mutations that the virus carries, where we know that that helps it to sort of dupe different parts of our immune response. But this is also another one of those things that we're going to have to wait and see how it behaves in different populations.
This question's from Martha. I'm just jumping around a little. We don't have a lot of time, but thank you for taking these questions. What does more contagious mean? What are the mechanisms by which the virus is more contagious?
Yeah. So there are a couple of different ways where a virus can become more contagious. Ultimately, what it means is that if I'm infected with one virus, then if I'm infected with a different virus that's more contagious, then I'm likely to spread it to more people. It really just comes down to the number of people that I'm expected to infect. And that comes down to the R number that we've heard a lot about throughout the pandemic as well. Just the expected number of people that an infected person is likely to go on to infect. So what makes a virus more contagious? Well, it depends a lot, but for SARS-CoV-2, really what seems to be one of the key things that changes its infectiousness is how easy it is for it to bind to our cells in the first place. So for a virus to cause infection, basically it has to stick to our cells so that it can then sort of hijack the cell's machinery to reproduce. When it does that, it sort of has to have these very precise structures on its surface so that it can recognize which cells to latch onto. And there are some configurations of the virus that it's been able to figure out as it's been spreading that allow it to basically be stickier, is sort of the way that I like to think of it. It sticks to our cells more easily and is able to cause infection a little bit more easily because of that. A couple other ways that it can be more infectious is if a person produces more virus or produces the same amount of virus but for a longer period of time, they're likely to expose more people or to expose people to a higher dose of virus, which can also make it more infectious.
So could that be different for vaccinated versus boosted, or Omicron versus Delta? Yeah.
Totally. Yeah. So one of the things that we found through our work with the NBA is that actually between variants, it doesn't seem like there's a lot of difference in how much virus a person produces or how long they produce the virus. But we did see that for a person who's vaccinated, they shed virus for a shorter period of time. Now, we don't know for sure if that is definitely part of what's behind making it less infectious, because we didn't actually run studies to see at what, basically when during a person's infection you're actually infectious. So for you to spread the virus has to be viable. It has to be able to attach to those cells. And at some point, even if you can detect virus in your body, that virus is going to be pretty mangled by your immune system, and it might not actually be able to cause onward infection. So by the time vaccination shortens that infection, we're not actually positive that that later side of infection is really able to cause many onward infections. Whereas at the beginning of infection, you're probably going to be very contagious. But that could at least be part of the story, that vaccinated people are definitely shed virus for a shorter period of time. And that could be part of why we see less transmission from vaccinated people in general.
Okay, I'm going to try to whiz through like 3 more questions in like 3 minutes. This gets more specific to what's coming up, but it's a situation with the holidays. My parents are immunocompromised. I haven't seen a parent in 2 years. I miss him. I'm vaccinated. When is it safe for me to fly and see my parents again?
Yeah, I feel for you. And I think this is one of the most complicated and difficult elements of this entire pandemic. I mean, I too have family members and friends who I've not seen in a very long time for some similar reasons. And I think it's really difficult when it comes down to delineating sort of what's safe and what is not. A lot of it sort of comes down to a person's tolerance for risk. Thankfully, it does seem like multiple doses of the vaccine, and especially boosters, do generally, for many people who are immunocompromised, elicit a better antibody response, give you better immunity, the more doses you get. There's a whole spectrum of things that can cause a person to be immunocompromised. And with each of those different things, there comes a different type of response to the vaccine. So it's really difficult to say, in your specific case, what actually would be safe. But I do think that in general, for a person who's visiting someone who's immunocompromised, for both people to be vaccinated as up to date with their vaccines as possible. And again, these other things that we mentioned, wearing masks, distancing, maybe seeing them outside, to lower the odds of spread would probably be a good idea. But I do think that with all of those things in place, there are ways that we can start to see these people and do so with some degree of confidence that they won't become severely ill.
Traveling internationally, I mean, you mentioned big picture travel bans, but there was a question that had come in, but what about safely traveling internationally? Is it just not a good time right now with Omicron? Or are there ways, or for people that do, what's the best way to do that?
Yeah, I mean, so as we had mentioned before, that the one of the ways to help prevent really giving fire to the spread of Omicron is to prevent large gatherings. And unfortunately, travel is one big gathering from end to end. And so I do think that, to the extent that we're able to reduce our travel, I think it's probably a good idea, for the same reason that it's a good idea to reduce our gathering sizes in general. But again, I think that at this point in the pandemic, we've learned so much about this virus and how to keep ourselves from spreading infection to others and from acquiring infection, that really by testing before travel, by wearing a good mask, by being mindful of distance from other people while you're going through the airport and these kinds of things, we can actually travel relatively safely. So I think, yeah, just be mindful of those things and be mindful of what you're doing on either end. But yeah, I wouldn't say we should start grounding everyone who hopes to travel during this holiday season.
Okay, I'm going to try to squeeze in one more question if that's okay.
Sure. Yeah.
And this kind of zooms back out a little bit. It's from Marcella. Are there special conditions that serve as breeding grounds for new variants that can evade immunity? Are there particular risks? For example, when a significant fraction of the population is vaccinated, but many are unvaccinated. Yeah, I wonder if we'll start with that and maybe can zoom out to wrap up the conversation.
Great. Yeah. So we are still early in our understanding of what generates new variants. We have a couple of different ideas of what might contribute to the emergence of variants. Some of those things include, that sometimes people who are immunocompromised, unfortunately and tragically, have very long infections with COVID-19, during which the virus can mutate within their bodies and then spread onward. But that's not the only thing that can lead to a variant. Sometimes a virus will just get lucky and it will have enough mutations pick up over time as it spreads from person to person to cause a new variant there as well. So for me, the single biggest factor in for generating variants, the thing that helps the virus to generate variants most, is for there to be a lot of virus spreading. The emergence of a variant is a very rare event from the virus's perspective. It has to get very lucky on a number of different points for it to have something that is more infectious and that is able to spread and really take hold. But it really increases the odds if there's a lot of virus spreading in the first place. So conversely, the best thing that we can do to reduce the emergence of new variants is to reduce the amount of virus that there is, because then
Wait, can you explain that? Yeah, because sorry, you're about to say.
Totally. Yeah. So the idea is basically that when a virus is spreading and it replicates, it makes small mistakes. And those mistakes are the mutations that come around in the virus. And if you can imagine that if there's not a lot of virus spreading, those mistakes are pretty rare. And so it's not going to be able to make many of those mistakes and generate new variants very quickly. But if there's a lot of virus spreading around, then each of these different viral replication events that's taking place all around the world is introducing these small tweaks to the virus genome. And just because of how much virus there is in the world, odds are that one of them is going to get lucky. One of them is going to be able to spread a little bit more easily than its neighbors. And then that thing is going to take off. So if we can reduce the amount of virus that's spreading, we basically just reduce how many chances it has to evolve a new variant, just because it needs a lot of opportunities to make those little mistakes before a variant can emerge. So the best thing we can do is just reduce the spread of COVID-19. And by doing that, we'll really help reduce the odds of a new variant emerging as well.
And it sounds like the best way to do that is vaccinations.
I believe so. Vaccination and everything else, though, too, that we had been talking about. So, as you say, vaccination in the face of Omicron, we're still going to see a lot of breakthrough infections. So vaccination, definitely very helpful here, will continue to prevent people from getting infected, but also masking, testing, ventilation, all of these things remain very important as we move forward as well.
I just want to give you a chance for some final takeaways as we wrap up this conversation. Thank you. It's split over a little bit
Sure.
in terms of, again, maybe summarizing what we really do know right now and don't know in this world of Omicron.
Yeah. So yeah, I mean, I just want to say thanks for inviting me on, and for everyone who asked questions. They've been great. This new variant is keeping all of us on our toes, and it's the last thing we wanted to see right now. And so, as far as what we know, we know that this virus is heavily mutated. We know that it is able to cause a lot of infections, even in people who carry some degree of previous immunity. But we also know that we're not back to square one. We know that our immune systems are going to hold up to some degree against this virus. We know a lot about the virus itself that help us, know how it spreads, when it spreads, and what we can do to keep ourselves and our communities safe. So I think staying vigilant about those things, and just holding strong for these next few months, because we're all extremely tired of this. It's been such an incredibly long haul. For all of us, scientists and non-scientists and everyone, this is just collectively as a world, this has been just like a really difficult couple of years. And so I think just, stay strong and remember all of the things that help us to prevent the spread of this virus. And I have a lot of faith that we'll come through this one together as well. So.
Thank you so much. That concludes our conversation. This Q&A has been jointly presented by the Forum at Harvard's T.H. Chan School of Public Health and the World from PRX and GBH. You can view the full discussion with Stephen Kissler on Harvard Chan's YouTube channel, and on our Facebook pages at Forum HSPH and at PRI The World. Thank you so much to Stephen and to everyone else for joining us today.
Thank you.